Welcome back. So today we are going to start another topic, MTP, Medical Termination of Pregnancy, in the continuation of chapter 4, Reproductive Health. Fine. So here whatever we have covered about the RCH program, about the human population growth rate, then what are different methods to control the population. We have done about the contraceptive method. So after using the contraceptive method, so what will happen? Still if there will be any pregnancy, so how we can terminate that pregnancy, that is MTP. So here are different objectives to do this. Now we'll start with the MTP. MTP is what, in general way, if you say it's a abortion or the intentional abortion. Okay, here I have written definition: intentional voluntary termination of pregnancy before full term. We know that in human beings the pregnancy period or the gestation period is of 9 months. So before that, if any pregnancy will be terminated, that is known as medical termination of pregnancy. Fine. So here what is the need of this thing? We will study all about it and what are the advantages of this technique. So here some points are there which we have to consider. 45 to 50 million, this data is very important. 45 to 50 million MTP is performed in a year, the whole world, or we can say 1/5 of the total pregnancy conceived in the world. So here, so how many people? 45 to 50 million people are going for the MTP with many reasons. They are having different reasons to go through the MTP. Now the government of India legalized this MTP in 1971. This data is very important. So in 1971, government has legalized this MTP with the strict condition. So here what is the meaning of strict condition? See, whenever there is a technique, so people are also misusing it. Fine. So to control this misuse, government said that there should be a strict condition. For example, if any female fetus is there, or with the help of amniocentesis, they found that the growing one is the female fetus. So what they were doing, they were using this MTP to kill the female fetus, or we can say female feticide. Fine. So that condition should be considered, that whether people are using this technique to do all these things or it in a fine way. Another condition is that sometimes people are also having different conditions. For example, if they have used the contraceptive but anyhow they get failed, so in that time they are using this MTP, or we can say MTP are used or MTP are adopted for termination of unwanted pregnancy, and this unwanted pregnancy will be done by different aspects. For example, we can consider that in the rape cases, what happens? The female or the girl should not continue this pregnancy period. So that time that pregnancy should be terminated. Fine. Another one is that the people or the couple not want to continue the pregnancy. In that period also they are going for the MTP. Another aspect, if any disease is there, of any congenital disease or the pregnancy which is harmful for the mother as well as for the fetus, so that pregnancy should also be terminated. So these are different reasons why the female should go for the MTP, but they should not be misused of this technique. Fine. Another one is, when we are talking about the MTP, so what should be the safest period? We know that the gestation period is of 9 months. So we have divided this 9 months into 3 trimesters. First trimester of 3 months, and another second trimester of 3 months, and a third trimester of 3 months. So which period is very safest and which after which it is riskier? So we can say the first trimester. It means first 3 months, and in each month we are considering 4 weeks are there. So total 12 weeks. So 12 weeks is fine or the safest period for the MTP. And after that, if you will go for the MTP after this first trimester, after 3 months, so it will be riskier for the mother as well as for the baby. It's a riskier, or it's they are going for the abortion, but it is riskier for the female that is going to deliver. okay, or that is going to terminate the pregnancy. So that time we have to consider about this time period. Okay, now another point is that methods. So different methods are there for this termination of pregnancy. Here I have written the first one is dilation or curettage method. In this method, what is the meaning of dilation? That's with the help of the dilation of cervix. Okay, the cervix has been dilated so that there would be a proper dilation in the cervix, and after that the practitioner, what they are doing, they are removing the implanted embryo, the embryo which has been implanted in where in the uterus. They are removing that implanted embryo with the help of dilation of cervix. So this method is known as dilation or the curettage method. Fine. Another one is vacuum aspiration. Vacuum is something related to suction pressure. So here in this method, again the implanted embryo which has been done in the uterus, with the help of vacuum aspirator, they are pulling that implanted embryo from the mother's uterus. And again this is the method for MTP, and it is safer in this first trimester. And if we are going for the extension of this time period, what will happen? It will be riskier for the mother. Now the third one is administration of prostaglandins. We can provide some pills, okay, PEGE, PGF2. So these are different types of prostaglandins we can provide to the that female which is in a pregnancy period. So how this will act? It will act as a contraction of uterus. So due to the action of this prostaglandins, there will be some contraction of uterus. Due to this, what will happen? The abortion will take place. Now what we are saying, these type of drugs we are using here, abortants. What are they? Abortants are those pills which we are providing to the pregnant woman so that it will help in contraction of uterus, so that there will be an abortion. Now another some drugs are there. For example, mifepristone. What are they? Mifepristone. It is one of the pill which we can say it is provided to the that women, so that what will happen, it will act as an anti-progesterone. What is the meaning of anti-progesterone? We know that progesterone is required for maintaining the pregnancy, so it will act opposite of the progesterone hormone. Due to what will happen, there will be induced menstruation, and due to this induced menstruation, what will happen? The implanted embryo will get slot out with the endometrium lining in a menstruation. Fine. So this is one of the method can be adopted, and this method again is very we cannot exceed the time period. If the time period will exceed, what will happen? It will be fatal for the women. Okay. Now we have done about the MTP. What is the use of MTP? What are the different methods to go for the MTP? So here, what is the significance? What is the importance of this MTP? We have done that to get rid of unwanted pregnancy, those pregnancy which is not required or which should not be continued. This pregnancy is known as unwanted pregnancy, and the reason can be what? The reason can be the rape cases in that one, as well as, for example, couple has adopted the contraceptive method, but they get fail, or we can say failure of the contraceptive method. So in that time, the pregnancy is unwanted. So they can go for the MTP. As well as what happens during this time, some couples needs to some more time for their children, so that time also they are adopting the MTP, but it is not allowed to all the couple or all the female to go for the MTP. Now another point is where continuation of pregnancy could be harmful or fatal to. It means that in that condition the pregnancy should be terminated, which can be harmful. How? We have done earlier in earlier chapter, that is ectopic pregnancy. What it is? Ectopic pregnancy. It means that the embryo get attached where into the fallopian tube instead of in the uterus. It should be implanted in the uterus, but somehow it will not reach up to the uterus, and it will implant it in the tubes only. So that time this pregnancy is harmful for the women. So that type of pregnancy should be terminated. Along with this, some more cases are there. For example, congenital diseases, some syndromes. So with the help of techniques or amniocentesis, what we are finding that if any syndrome is there, in sonography what they are doing, they are detecting that is there any diseases there in the growing fetus. If it is any syndrome is there, so it should be terminated, because if there will be birth of this child, so it will be difficult for the parents as well as for that baby. Okay, so it will be very difficult situation. So that pregnancy should be terminated. Okay, so now we have done about the significance. Now some drawbacks are also there. We know that some people are using this method for the different purpose, or we can say drawback. So it is being misused to about normal female fetus. So with the help of techniques, they come to that if any female fetus is there and all the functioning are fine, but still they are going forward for the female feticide. So we have to check on all these things to prevent this female feticide. So this is the main drawback of the MTP. Now it has raised many emotional, ethical, religious and social issues. It is written in your NCRT. So what will happen if any MTPs are there? So people are connecting these aspects with different things. For example, we can say some people say it's very bad to kill that baby or to kill that embryo. It's a mass of cell. So different people have different aspect related to this MTP. So it is creating some problem in their emotional level, or their in the ethical level, or their religious and social level. Now the third one, performed illegally by unqualified quacks, which may be fatal. So we have seen that in rural areas, what happens? So uneducated people are familiar with all these things. They are going for the abortion directly. They don't have any skill. Okay, they don't have any knowledge, but as they are performing frequently, so what they are doing, they are performing this type of MTP. So we have to check on all these things, and we have to see that if such type of unqualified quacks will go for the MTP, there may be a fatal, or it will be harmful. Sometimes we have seen that the women which going for the MTP, they got died. Why? Because due to some problems, they are not so much educated about the medical things. So it is required that these are the drawbacks in the rural areas, because people are not aware about the whole things. So here we have done about the medical termination of pregnancy, when it is required and where we have to consider. Fine. And government is also seeing all these things, and for MTP, the recommendation of medical practitioner is very important. Even in the first trimester, it is important to take suggestion or to take the consultation of the medical practitioner. And if the MTP is after the 3 months, so again there will be need of more medical practitioner suggestion or the or any prescription. Why? Because it will be more riskier as the period will get over. Fine. So here the next topic which we are going to start, that is sexually transmitted diseases, STDs, or sexually transmitted infections. Topic, sexually transmitted diseases. So these diseases can be called by another name also. For example, I've written here venereal disease or VDs, or sometimes we are saying reproductive tract infections, RTIs, or sexually transmitted infections. So there are different names. What's the meaning of sexually transmitted disease or infection? Those infection or those diseases which can be transmitted through the sexual intercourse or during the sexual activities, those diseases which are transmitted from one person to another person. Here we have done about the contraceptives, that during the coitus there must be a proper protection. If there will be no protection, what will happen? There will be more chances for the transfer of disease, and these diseases can be of different types, or the causing agent can be of different types. So here, First of all, we must know that what is sexually transmitted disease. The disease which can be transmitted through the sexual intercourse, it is known as sexually transmitted diseases. Now, and what are the different sources by this STDs can be caused? The first one is by bacteria. Bacteria can be the causal agent for the STDs. And what are the different diseases comes under the bacteria? Chlamydiasis, gonorrhea and syphilis. Okay, these type of diseases caused by the bacteria. And the another one is by viruses. Viruses are also causing some diseases. For example, AIDS, hepatitis B, genital herpes and genital warts. Now we know that about AIDS, that what is the causal virus? It may be the HIV virus which causes the AIDS. Or what is HIV? Human immunodeficiency virus, like this hepatitis B virus. So these are the virus which are causing what? They are causing some STDs or the sexually transmitted diseases. And the genital warts, HPV, or I have written here HPV, a human papillomavirus is responsible for this genital warts. Fine. So we have to memorize all these examples, how they are causing and what is the causing agent. These are important from the examination point of view. Now the third one is the protozoans. We have done in 11th grade also that what are the protozoans that may cause some infection. So what is that? Trichomoniasis, which is caused by the Trichomonas vaginalis. So during this time what will happen? There will be discharge of some liquid fluid or the whitish liquid fluid, and what they are causing? They are causing leukorrhea, and again these diseases are very harmful for the human beings. Now when we are talking about some diseases or the infection caused by bacteria, viruses, protozoans, so they are showing some symptoms. See, if we can detect these symptoms at the earlier stage, so it will be easier to cure that disease. But if we will get late for detection of these STDs, what will happen? They will lead to some fatal diseases. So it is required that it should be detected in the early stages. Fine. So here I have to add that these three diseases, AIDS, hepatitis B and genital herpes, okay, three diseases cannot be cured. Prevention is important in these three type of diseases. That's why there is one quote: prevention is better than cure. So it is highly applicable for these type of diseases. But among all these things, all the diseases are can be curable. Okay, but the condition is that it should be in a initial stage. Fine. So what are the general symptoms for all these things? So whenever we are talking about the STDs, it means that something related to the genital tract or genital area. So what will happen? There will be some itching or fluid discharge or some pain, some slight pain or swelling in the genital area. So what is affecting whole over, whether it is a male or the female, they are very harmful for the male as well as female. Now, so what can be the complications? We said that it should be curable in the initial stage. If sometimes it happens that the symptoms are not seen. In some people, we cannot detect the symptoms. So what will happen? We will get the last stage, and we can say if we will get the later stages. So what will happen? That time it will become complication for that individual. So what can be the complication? Very important complication is PID. So in this PID, what will happen? Pelvic inflammatory disease. It means that in the pelvic region of the body there will be some inflammation, and this inflammation will cause different diseases or different happenings in the body. Sometimes it leads to the abortion, stillbirth, the children which are there will be birth of deaf children. So these are some causes or conceptions, complications done by the STDs, or sometimes ectopic pregnancy. All these things are happening in the body or in the growing fetus. So we have to think all over it, and the main thing of the PIDs is that it will lead to the sterility of the male as well as female. So here it is important to know that, or to detect these diseases in the earlier stages, so that it can be cured by the doctors. Now here this point is very important. So incidence of STDs are very high, or in the higher risk in the 15 to 24 years, because this is the period in which they are the childrens or the youth, they don't know what to do and what not to do. So here it is required that they should not be distracted, and this age period is very, very important because there are more chances of getting STDs. Okay, now how we can avoid these things, how we can control this thing? Again, prevention is must for these STDs. If we will not take care of the prevention, what will happen? They will affect the body. Fine, the first prevention we must take, the avoid sexual practices with the unknown or multiple partners. There should be no unknown partners, or there should be no multiple is more than one partner. So this sexual practices must be done between the known one. Fine. As well as the second one is use of condoms during the coitus. We know that what is the use of this condoms? To avoid the unwanted pregnancy, as well as to avoid or to prevent the STDs or the sexually transmitted disease. So whenever there is coitus or the intercourse between male and female, there must be use of condoms. So if they are using the condoms, what will happen? They will prevent these type of diseases. Now the third one is visit a doctor immediately as you are detecting any complication, as you are detecting any symptoms. So just visit to the doctor and go through the medicines or the detection and treatment for that STDs. So this is all about the sexually transmitted diseases which we have to control, and how we can control by adopting these measures. Fine. So here almost we have done the completed chapter. Now another topic which we will cover in the next session, that is infertility. Fine. So that's all for this lecture. Thank you.